Hi girls, this revision video is about the joints, specifically the types of joints that we've learned. So just remembering that there are three types of joints. We're talking fibrous joints, which are held together by only ligament, for example your teeth. Cartilaginous joints, where the connection between the two bones is cartilage, for example between the vertebrae or between the sternum and the ribs, and I'll show you an example of that in a tick. Or synovial joints, which are the most common type of joint, and they contain synovial capsule and hyaline cartilage to lubricate and cushion the end of articulating bones, so two bones that are together. So without that cartilage and the capsule, the bone-on-bone impact would result in degradation of the bone, so the bone's getting worn down over time. So it acts as a protector. Now, if we look here, these are good examples. So this is a ball and socket joint, for example, and it's a type of synovial joint where there's that cartilage covering the bone, and you've got a bit of a capsule happening there. We've got cartilaginous joints, as we discussed before, like between the ribs and the sternum, or between the vertebrae. You've got an intervertebral disc, which is cartilaginous, and then we've got fibrous joints. So, for example, like a tooth in the gum, like between the bones of the skull, or like between the radius and the ulnar, just keeping them together so that they're not randomly floating away. As I mentioned before, synovial joints are the most common joint in the body, and there are different types of synovial joints. So we have the pivot joint, and they usually do what they say. So, for example, at the neck, we can pivot our neck around. We've got a hinge joint, does literally act like a hinge. So for example, in the elbow, we have a saddle joint, which has some movement slightly in two planes, sorry. So an example of that is in the carpals. We have a plane joint, which has movement again in a number of planes, but an example of that is the tarsals. We have condyloid joint, so for example between the radius and the carpal bones, which allows a bit of twisting. And then we have the ball and socket joint, like in the hip between the pelvis and the head of the femur. So they're the types of synovial joints that might be handy for you to know, keeping in mind that the purpose of a joint is to allow movement around in multiple directions and multiple planes, but that the joints require contraction of muscle for that movement to occur. But we'll talk about that in more depth in another video. So that is joints in a nutshell. Make sure that your notes are correct and that you revise by testing yourself as you go. Thanks, girls.